Okay, from your exercise sheet, this is exercise number 2, which I call the thumb move. Here, we're going to contact the lateral aspect of the SP in C6 or C7 or C5 on C6 or even C7 on T1, depending on what the patient needs. So the rest of the hand is grasping the clavicle if the patient's small enough for that, and you're simply going to ease in until you feel that SP. You're pretty sure you're on that. These joints exist in more of a coronal plane, so the thrust is going to be pretty much in an oblique plane like this, and then the other hand, the indifferent hand, is cupping the occiput and maybe rotating toward your adjusting hand. Now this is good for adjusting the motor segments and even a first rib. If it was a first rib adjustment, the emphasis of the thrust would be less on the thumb and more on the radial aspect of the rib, or of the hand here, in order to contact that first rib. So that would look something like this. And let's see, I don't think Maria really needs an adjustment here. We're going to give her just a little jiggle just in case. So I've got the lateral aspect of the SP on C7. I'm going to rotate the head into my adjusting hand, get my elbow up here so that I can thrust in more of a coronal plane, left to right, and just like that. And of course the reverse is grasping the other side, locating the SP with the other hand, rotating into the hand, and thrusting. So this thumb move is an exercise where you can either separate the different components. In that case, I would simply program my unit starting with a light spring and a generous or liberal margins for error setting. The contact is the radial aspect of my index finger. Get my elbow out there where it wants to be in order to induce an oblique plane adjustment. Ease in and thrust. Now see, I'm stabilizing the unit here. In my opinion, that's the best way to do it for that particular adjustment. If you wanted to turn it around like so, it's the same thing pretty much. Just like that. So this same exercise can simulate inducing rotation on the cervical thoracic segments, or even a first rib adjustment where the thrust is slightly more superior to inferior, but almost the same plane as the facets in the thoracic spine.